Hello, and thank you for joining us. This is No Soundbites Allowed, and I am your host, Michael Voss, Dragon of the Southern Tier. I'm happy to be here with you today as we're going to be talking about a world-changing event, news that has come out and you may or may not be hearing about that will change your life, whether you're an American citizen, whether you live anywhere else in the world. The dominoes have been set, and now we are seeing them start to fall. And this will change our lives. How it will change our lives is yet to be seen, and we'll discuss that in just one moment. But first, we want to mention to you, if this is the first time that you are seeing our channel, we welcome you and we thank you for joining us. We want you to know that we do long-form political commentary. And every Sunday at 2:30 p.m. Eastern Standard Time, we do a live stream with you. We reach out on all social media that the internet overlords will allow. We take your phone calls, your chats, and your tweets, and we listen to what you have to say about the issues that affect us all, because we believe in the First Amendment. We believe in your right, regardless of what country you may live in, to be able to speak about things that matter to you. And so we hope that you will join us every Sunday at 2:30 p.m. Eastern Standard Time to share your thoughts about these events that affect all of us. Whether your government approves, whether or not the internet overlords approve, we look forward to hearing you. With that said, let's move on to talk about the earth-shattering news. This is definitely a dramatic change that we are seeing, and it has started in the United Kingdom. You may or may not be aware of this news, and given its nature, I expect it to be somewhat suppressed. We see that Boris Johnson has now decided that face masks and vaccine passports will no longer be useful in the United Kingdom. He goes into great detail, and it is stated that mandatory vaccine passports will no longer be used, that people will no longer be advised to work from home, that face masks will no longer be mandated, and that students will be able to go back to school. In other words, life can return to normal. We can go backwards in time to 2019 instead of where we have been. That the stagnation that has affected both the economies and the lifestyles of millions of individuals around the world, actually globally everyone in the world to some extent, will cease. And the United Kingdom is the first nation to do so. And we're seeing that news is being somewhat covered by the news media, not just the BBC, but AP News, Reuters, CBS, and ABC to an extent. And in each case, what they're telling us is, well, it's over. We've reached the peak. There is no more need to take care of this issue. The issue is behind us. But that's not really true, is it? There is always another variant around the corner. There will always be this pandemic with us to some degree or another. We've been told that over and over again. In fact, as we have covered this issue all the way through, we were talking about this in December of 2020, when we were being told that mandates that we were initially told would never exist had to be implemented, and that there were some people who could be exempted, but really, no, you had to get this. We started with and guarantee that we wouldn't have a mandate from the government, that it was impossible for the government to do that. Then we went to, well, this is something that we must do for your good health, even though the government has no idea what your health care is as an individual. And we were told, well, we would exempt many individuals, like women who are pregnant, individuals with cancer. And then we were told, no, that's not actually going to happen. That everyone was required to receive these mandates, these vaccinations, and we were told that you would need to have proof of this to be able to remain employed. And as the year went on, as we went through 2021, we saw more and more of government agencies demanding that you must comply regardless of what religious or medical reasons you may have not to do so. And one of the hardest hit group of individuals being affected by these mandates were in fact doctors and nurses and healthcare workers. In New York State, we saw as hundreds came out day after day protesting these mandates. In New York State, the bluest of the blue, under a Biden-Harris administration, with the appointed Governor Kathy Hochul in charge, we heard her state, you must comply with the government no matter what. Even as doctors and nurses and healthcare workers came out in droves to tell us no, they didn't agree, and no, they would not comply. The result of that, of course, was Representative Kathy Hochul, as she demanded and put down an ultimatum. If you did not comply with her will, with her desire, with her political party's point of view, if you did not submit, well, then you would be fired. You would be removed. Even though this would negatively impact the average citizen in America. They took the heroes from 2020 and they turned them into villains in 2021. And the consequences of that, be damned, you will comply or else. The result of that, of course, was that we saw over 3% of New York State's healthcare disappear. Doctors, nurses, healthcare workers, they're gone. And of course, this had a massive impact on healthcare for the average citizen in New York State. 34,000 people, 33,982 to be exact. So 34,000 doctors, nurses, and healthcare workers disappeared from the workforce. They were no longer there to take care of people in hospitals, in nursing homes, in adult care facilities, or at in-home treatment. And as a result, we saw hospitals shrink. They reduced the number of their staff. They increased the number of hours that their staff were working, which was already extended, furthering the burden on each and every one of them, and reducing the type of care that could be received. Reductions in people receiving dialysis, in terms of people getting cancer treatments, in terms of individuals getting every kind of treatment you could think of, no matter your age or what the problem may be. Now, let me be very clear, especially for the censors on YouTube and Facebook. We're not doctors. We're not advising you to take the vaccines or not to do so. That is not our purview. We are responding on what has happened, that there were doctors and nurses that said, no, we are telling you that the government initially started in 2020 guaranteeing that there would not be a mandate, that there would not be passports required to have employment. And we then saw the government change its point of view based on the same exact science that existed throughout the entire process. You may think, well, what do we mean? Well, it was held, and it has always been held, that natural immunizations are stronger than any other form of immunization. That's been historically true until this pandemic, where we were told over and over again that natural immunization may not be the superior, that the medicines created in laboratories were better than what we had, even though these medications were created in the fastest time frame ever. No drug has been put to mass use to such a large scale with so little research having been done beforehand. That is a fact. It is a fact. The FDA process normally takes 7 years on the fast track to reach the general public, to make sure that it is efficient and that there are minimal side effects. What we have seen under this pandemic and these medications is that instead of trying to find out the facts, the government has decided you must comply. And then we find out, as reported by Reuters on January 19th, that prior natural immunity is more protective than the vaccinations that have been mandated on each and every American citizen and those around the world, in the United Kingdom, in Canada, in Australia, and New Zealand, which stand out as exceptional locations and nations that beat down their public, saying you have to comply, even though the science, as we are learning and as we have known, states natural immunity is better. And that we know that the latest variant is even less deadly than the original variant, which was 97% survivable and remains at least 97% survivable. These are facts. They are science. They are indisputable based on the scientific research that has been done and has confirmed. You may like it or not, that has nothing to do with what we have found over and over again. And yet we have had governments, not just in the United States, but in the UK, in Australia, and so many other places that have continued to say, you must be afraid and you must comply. In fact, Joe Biden has made a contract with a German company to create a factory in Germany to create the pandemic testing for the next 5 years. This is a facility that doesn't exist. It will be created with the United States tax dollars in Germany for a German company to create a product that will then be sold to the United States and distributed to American citizens, which is great for the German economy, not so much for the American economy. You may say, well, why is that the case? Well, part of the reason is, of course, that we know that the Biden-Harris administration are now sending out free tests, that they're going to be sending them to people's doors. You just have to request it. Of course, it takes 7 to 10 days, which means it is effectively useless. If you have symptoms today and you request that test, you will not receive it for 7 to 10 days. Actually, according to the news, NBC, we see that the White House has said the test will typically ship in 7 to 12 days, which means it's going to take even longer. In fact, it is taking so long that it is beyond the quarantine period recommended by the CDC of 5 days, and it is longer than normally the entire time frame of the infection, which means that this is a investment, $137 million, that will continue to feed into the same fear that we have been receiving for the last 2 years. And therefore, it means that we will have restrictions foreseeably in the United States for at least 4 years. Boris Johnson is saying that we have won. We have defeated the pandemic and its latest, less deadly variant. And it is doing so to the extent that children will go back to schools, that masks are no longer necessary, that the passports are no longer required to be able to enjoy life and to work. If that is the case, then why is the United States continuing on the path that is going on? If the science, which does not change from one nation to another, is sufficient to say that people can regain their lives, why are we seeing the United States continue to push to restrict people's lives? Why is this not an action being taken in every other country in the world? Because the science is consistent. We know that the latest pandemic variant is less deadly. We know that the pandemic overall is 97% survivable. That is fact. Then why are we continuing down this path? Why are nations all over the world not jumping on the same bandwagon as in the United Kingdom. It's because it's all about politics. That is our impression, that is our point of view. Now, you may disagree with that conclusion, and that is perfectly fine. Again, we're not doctors. We're not here to give you medical advice. We advise you that if you wish medical advice, go to your healthcare professional and ask them for their advice, not the United States government, which doesn't know anything about you as an individual, not some news media agency, not some website. Go to your healthcare professional and find out what they believe is the best thing for your health, as per their Hippocratic oath. But we can look at this from the political aspect because there is politics involved here. Politics surrounding the pandemic allows various governments more power than they have ever had before, and power corrupts, and absolute power corrupts absolutely. That is a truism that has never been proven wrong over time. But in the United Kingdom, they are making a change that no other nation has made so far, based on the same scientific data that other nations, like the United States, like Australia, like New Zealand, are using to lock down their citizens, restrict the freedoms of their citizens. In the United Kingdom, they're about to release them on the same scientific data. Why would the United Kingdom do that? It breaks the solidarity of these nations because Boris Johnson is in political trouble. Boris Johnson is about to be deposed and replaced, quite likely. Through the normal elective process of the United Kingdom, this is all completely legal, but he's in trouble. He's had far too many scandals. There have been too many examples of the Boris Johnson administration violating the very same rules that he is now releasing the rest of the public from. So this could be seen as an appeasement to the public, saying not only is the Boris Johnson administration not held to these standards or these restrictions, the public shouldn't be either. And now the people are allowed to be free once again, with the backdrop answer of being, well, we've gotten through this pandemic, this latest variant, with the understanding that the pandemic hasn't gone away. The variant will continue. There will be another variant. It will go through the rest of the world. But to quote Boris Johnson, this should not be seen as the finish line because the virus and the future variants cannot be eradicated. Instead, quote, we must learn to live with the pandemic in the same way we live with the flu, end quote. Well, that's something that's very interesting because we've heard someone say that before. In fact, we have heard millions of people say this before during the vaccine mandate protests in New York State, in Arizona, in every state, in every city in the United States. We've been told this already. We've already heard people say that natural immunity is superior to anything that has been created by science. And yet we've been told continuously we must be fearful. And now we're being told, treat this like we would treat the flu. So the crisis is over. Freedom comes back. And if the United Kingdom is willing to do that, how can the United States not return back to normal? Or Australia? Or New Zealand? Let me ask this question. What is the consequences of this? The United States must change its point of view. It must, if the science must be believed, and the science is telling a nation that it is okay to go back to normal, then America, based on the science, must come to that same conclusion. Which means that the laws that are in place right now, restricting the freedoms of individuals, that are punishing people, the costs and the expenses that have been spent for years to the future, they must end. That means the $137 million spent by the United States in Germany is a waste of money. And we have to look at this and say, well, what about all those workers? There are 34,000 doctors and nurses and healthcare workers in New York State alone, not even counting the rest of the country. In New York State alone, which negatively impacted the health care of American citizens. Do they get to now have unemployment insurance? Do they get to go back to their jobs? If New York State is capable of being able to hire them, because many have left to go to other states who also are short-staffed and also had less doctors and nurses than necessary. In fact, in the United States, there is a shortage of doctors and nurses of 1.8 million in 2019, and this pandemic only made that worse. So do we take off the punishments and just say, oops, we're sorry? It's over now. You can go back to work, no hard feelings. What about the individuals who were fired from individual businesses because a mandate said the science required them to do what the government is saying, even though the science is showing that natural immunization is better, and the science is showing that in England, people can go back and have their freedoms. This is the science that is being presented by nations and reported by the major news media. We are only asking the question about the consequences. We're not telling you what to do. We're asking, what are the consequences? What happens? How do we go back to normal? And what happens if there's another variant? Do we lock down everything again? Do we treat this like any other flu? Do we restrict the freedoms of every single one of our citizens? What if Boris Johnson wasn't in trouble? What if his administration wasn't suffering? Would he free them then? Would he have released the United Kingdom's citizens? What about in the United States? Joe Biden is at 33% approval, one of the lowest levels of any president that wasn't actually removed, as in President Nixon, who was at 25% when he was removed from office. Joe Biden has been mocked and ridiculed. His administration to date has been a complete failure on every aspect that it has done. It has missed every single target it has presented to the American people, economically, socially, in terms of the pandemic and otherwise. Does he now say to benefit himself politically, will we see in the United States that they will then release all of the mandates, that they will stop all the requirements, that all the federal funding and spending that has gone on will end? Because, again, there is a huge political component of what is going on. The science hasn't changed. The science has been consistently showing us natural immunity is better. The science has consistently been telling us that these vaccines need to be more tailored. What are the consequences? Looking at Australia, what about all the people who have been imprisoned voluntarily? Voluntarily meaning that they were told, get in a car and go to a encampment, a facility, and to go there or be fined $5,000 or Australian dollars and then be taken there anyway. So not really voluntary at all. What about all those individuals and the way it's disrupted their lives? What about New Zealand shutting itself down economically and socially, just shutting down the nation? The impact of this is massive because the question comes up, how can the United States, Australia, New Zealand, Canada, France, Germany, Israel, how can they continue to restrict the freedoms of their citizens while the United Kingdom is releasing its stranglehold on freedom because the science that is exactly the same for all of them says people should be free. The science says fear should end. If the science is saying that for the United Kingdom, how can it not say that for the United States and the rest of the world? And then, what are the consequences? Both if the United States refuses the science that the United Kingdom is asserting and to keep its people in a stranglehold, there's another consequence to consider. because the politics of the Democratic Party, of the Biden-Harris administration, are absolutely vested on remaining in power, on the public being afraid. They are detailing law around this fear. And their answer is, well, the science says we should do this. And yet England is refuting it, saying the science says go back to normal. Go back to 2019. They are saying let's actually live the promise. The promise that we were told 15 days to lower the curve. Over 600 days later, we still have not done that. But England is about to start. Politically, in the United States and in many other countries, it is in the best interest for those governments to keep the fear and to ignore the very same science that the United Kingdom is now citing. Politically, shouldn't be part of science. Politically, shouldn't be the reason why freedoms are restricted. That is our belief. Your health care is yours, and you should speak to your health care provider to make whatever decisions you need to. You should evaluate any medication before you would take it. You should be able to speak out to your government at every level of government and to question their actions. Because that's what America is about. That's why we were created. To be able to speak to our leaders and to question our leaders and not to be blindly subservient. This could be the start of freedom returning to the world in 2009, as it was in 2019. Governments, in love with the power they have received, will continue to maintain that power. And that, if it happens, will be a declaration of fear-mongering that has held the world in its grips for 2 years. You may disagree, and we are happy to hear your point of view. But in looking it over from the beginning till now, looking at what the current result is in that first domino falling, I think many governments must take a serious look at themselves and seriously explain to their public the next steps they will be making in this near future. We hope that this will be the beginning of a return to freedom. We expect that it will not, at least not under the Biden-Harris administration, at least not in the United States. We look forward to hearing what you have to say about this, and we hope you'll join us every Sunday at 2:30 p.m. Eastern Standard Time for our live stream to discuss this and many other issues.